Okay, so that's Oprah Winfrey there speaking to Idris Elba. But there's another video where Idris specifically speaks to the issue about the black race and the myths that's been going around in terms of why we can't get it. But that's not the video that we play. So let's come back to the studio to talk to Dr. Paul Owusu Oduro, who's a public health specialist. Good morning to you. A lot has happened since we last spoke on Friday.
That's right.
Yeah. What has changed?
Nothing has really changed. What we are seeing is expected. And it's going to get worse.
Still?
Yes. Despite the measures we've put in place.
As in Ghana? Because we
globally. I am not scaring anybody. This is probably not a good time to harbor fear or anxiety, because fear or anxiety will weaken your immune system. And then we know that most of the people who have died as a result of COVID-19 are those who have weak immune system. Let's akin the infection of the virus to an armed robber who attacks a house. So your house, the house becomes the body of the host, and the armed robber in this case is a virus. If you have a strong immune system, it means the door to your house is secured. So the virus attacks as the armed robber. It may be able to break into the house, but because the door is secured, even if it succeeds in doing that, it would have spent a lot of time and then resources. So by the time it gets into the body, it would have been weak and wouldn't be able to cause a lot of damage. But if you have a weakened immune system, it's like you opening your door. So once the armed robber comes, there is no resistance. It just enters, and with full vigor and energy, it starts causing the disease. And that is how come those with weak immune system suffer most and are most often unable to recover and then die. So at this stage, yes, it's going to get worse. We are going to see more infections globally and then possibly more deaths. But it's expected. If I get the opportunity, I will explain why.
Okay, sure. So let's talk about the global outlook now. Let's look at some of the figures. At least 339,000 people have contracted the novel coronavirus, and over 14,700 have died, according to a tally by Johns Hopkins University. Millions of residents, and this is some of the happenings around, millions of residents living in 75 districts across the country, and this is India, have been placed under travel, work and movement restrictions until March 31st. Canada is the first country to announce it won't send a team to this year's Tokyo Olympics. U.S. death toll rises. More than 400 people have died from the virus in the United States. This is according to CNN's tally. So more figures from around the world and how other countries are handling this deadly pandemic. I'm giving you the opportunity to explain why we will continue to see higher numbers.
All right, that is fine. So for the people who harbor the virus, we have two types. Those who are showing signs and symptoms, those are we call symptomatic, and those who are not showing signs and symptoms, the asymptomatic. The fact that I am not showing signs and symptoms doesn't mean I don't have the virus. And once the virus gets into me, definitely I will exhibit the signs and symptoms along the line.
If you're not showing any symptoms, would your temperature still rise?
Temperature is a symptom. So if you are not showing symptoms, then temperature may be normal. Good. So once I harbor the virus, if you look at the incubation period of the virus, that is when it enters, the time between when it enters and when it starts to cause the disease in quotes. So that is when you see the signs and symptoms. It's 14 days. So if I have the virus, probably maybe this may be my day 4. I'm not showing signs and symptoms. I have up to 10 days to exhibit that. It doesn't mean I don't have. So despite the lockdowns and all those restrictions, those who already have the virus and are not exhibiting will definitely exhibit. So they are going to add to the statistics we already have.
Okay.
That is why I'm saying, despite the measures we've put in place, we are still going to see a rise in the figures until the measures, have effect on what we are doing, and then it starts declining.
Okay, so if you're not showing any symptoms, but you say you will eventually show symptoms.
Definitely.
Okay, but you could be passing it on without knowing.
Exactly, and that is the worry we have as public health persons. Unfortunately, there is nothing the person can do because he or she doesn't know. It's not deliberate passing on to other people. But what we know is if you practice these precautionary measures, social distancing, proper hand hygiene, cough and sneeze etiquette, you should be able to limit the spread to yourself so that you don't pass it on to susceptible individuals.
Okay. Today we wanted our conversation to also look at pregnant women, and then also look at the children. Because I was thinking about the fact that I go to work, my children are at home.
Yeah.
And what should I do once I get home? And how should I ensure that if I contracted it in the course of my work, I don't pass it on to any innocent person who is at home? But I wanted to also talk about, the thing about Idris Elba, the fact that he had it and his wife, who didn't have it, decided to take care of him. Yeah. And obviously, in the process, also contracted it. Yeah. And she said she knew the possibilities, but that's your husband. And if your husband is unwell, how do you then say that you can't take care of him, or you will not take care of him? So the home, let's talk about the home. Maybe we should start with the specific directions for pregnant women.
Okay.
If I am possibly carrying it, can I give it to my unborn child?
So far, there hasn't been any research to suggest that the virus can be passed to the unborn child. So I wouldn't be able to speak to that. But it being a respiratory virus, I doubt.
If it can be passed on?
I doubt.
Okay. All right. So then let's move to, but what do pregnant women have to do any specific thing around this time, or they are also taking the general measures that we've all been given?
Naturally, because of hormonal changes, pregnant women tend to have weakened immune system to some extent. So if that is the case, then the best thing to do is to assume everyone else around you has it, so that you wouldn't get closer to them. Once you have that notion, consciously you'll be able to practice some of these precautionary measures very well. We also know vitamin C is a good immune booster. So a lot of vitamin C at this time, and then enough rest.
Okay.
Is what you need to at least stay healthy.
Okay. If you can't get hold of the vitamin C tablets, you can use oranges to replace that?
Any fruit that contains vitamin C. Just that probably you have to take a lot in order to get the right concentration.
Okay.
That's right.
All right. So there was one thing I said to myself yesterday. You're asking us not to stress and have enough sleep. But looking at the numbers, looking at the challenges, watching Italy alone, you could be stressed just from listening and watching to what's happening elsewhere. So how do we get this rest that you're talking about? How do you not stress?
The thing is, if you worry, you will not be able to halt the spread. So why worry? Weaken your immune system and then expose yourself to it. The thing about COVID-19 is that most people